health alert tonight. Severe flu activity is spreading across the U.S. and in our region, D.C., Maryland, and Virginia are all registering very high activity levels, according to the latest numbers from the CDC. Health officials worry that the situation will only worsen as the holiday season gets underway. Rafael Sanchez Cruz has more on this growing concern. Rafael.
Charlotte, nearly 20,000 people in the U.S. were admitted to the hospital last week for flu. That's almost double the number from the week prior. According to the CDC, Virginia is among the 11 states that have been hit the hardest by the influenza virus.
Take a look at this map. The states in red and purple are those registering high or very high flu activity, according to the latest numbers from the U.S. Centers for Disease Control and Prevention. That's nearly the entire country. Virginia has reached the highest level. Just this week, the Virginia Health Department reported the first pediatric flu-related death this season. A closer look into the Commonwealth's data shows that children between 0 to 4 years old made up close to 22% of the flu-related hospitalizations last week.
At the peak of the COVID-19 pandemic, we saw record low numbers of flu specifically. Shouldn't surprise us. We were on lockdown. Now that we've seen all of those things lessen, we expect those numbers to come up.
The district and Maryland are just below Virginia, also with very high flu activity. With flu, RSV, and COVID-19 putting a strain on hospitals, health experts are urging people to get vaccinated.
Best tools we have in our toolbox are the two vaccines that we have available, COVID-19 and flu. I always try to remind people that you don't have to stagger them. You can get them both at the same time.
With respiratory illnesses on the rise, painkillers for children are getting harder to find. Johnson & Johnson, which makes children's Tylenol and children's Motrin, is increasing its production to meet the demand, Charlotte.
And she gave lots of good advice of how and when you should get those vaccines. All right, thanks so much, Rafael.